webinar is brought to you by Downtown Partnership of Baltimore, the nonprofit organization that's been making Baltimore better for 35 years. Downtown Partnership created the Downtown Partnership Resident Network to facilitate community participation amongst downtown residents. We provide resources, host events, and advocate for our downtown neighborhoods. The network covers the 1 mile radius of downtown, which includes the neighborhoods of Charles Center, the Broma Arts District, University of Maryland, Baltimore, Little Italy, Harbor East, Federal Hill, Mount Vernon, and the Inner Harbor. My name is Emily Breiter, and I'm the Director of Economic Development and Arts Initiatives at Downtown Partnership. I am also joined by Claudia Jolin, the Vice President of Economic Development at Downtown Partnership, who will help facilitate our Q&A at the end. We mentioned this in the chat, but you are more than welcome to ask any questions throughout the webinar in the Q&A chat feature in Zoom. I'm excited to introduce our panelists for today's webinar, and we'll switch to the next slide. We have James LoBosco, the Executive Vice President of the Hotel Division of Southern Management Corporation. James has served in the hospitality industry for over 30 years. During the current crisis, James serves on Southern Management Corporation's COVID task force and oversees communications for the company. Our next panelist is Dr. Panagis Galiatsatos. Dr. Galiatsatos is an assistant professor and physician in the Division of Pulmonary and Critical Care Medicine at Johns Hopkins School of Medicine. He will discuss health and wellness best practices during COVID. And with that, I will turn it over to James LoBosco.
Thank you, Emily. Appreciate it. And good afternoon, everyone. And thank you to the Downtown Partnership Baltimore for hosting this webinar. I've been asked to provide a snapshot of what Southern Management had done as it relates to communicating and providing information to residents. And I guess it was early to mid-March, our CEO, Suzanne Hillman, made it very clear that our primary concern throughout this crisis was the safety, health, and welfare of our residents and employees. With that, we had two primary goals: to meet our residents and employees' essential needs, and two, to protect to the maximum extent possible the well-being of our residents and employees. Suzanne Hillman then created the COVID-19 response team. Now, this response team was comprised of several leaders throughout the company. There's about 15 people that serve on the task force, and they're all senior vice presidents, executive vice presidents. Our general counsel is on the team. Suzanne Hillman serves on every call. She has been on in every meeting. The team is led by our chief strategy officer, Charlie Price. And Charlie, Charlie's got about 40 years experience in law enforcement and with the FBI, and he's just a master at organization and discipline, and has effectively coalesced a team to address the concerns that face our company every day. Now, this COVID task force was brought together, as I said, mid-March. I think it was on Friday the 13th or Saturday the 14th. We had our first meeting. We had met twice a day until we really got this thing down to a science. We were meeting twice a day religiously, and we would review every possible thing that affected us as it relates to the pandemic. And, whether it was, is there a potential exposure? Is there new guidance coming through? Is our current systems working? Are they all working? Or do we need to develop new standard operating procedures? The COVID team would review everything in its entirety. And this team, having a team of leaders like this together to deal with this situation, if you remember back to mid-March and even to today, guidance is changing so rapidly and everything's evolving so quickly. But back in mid-March, it was really evolving quickly. And this team was able to decipher what was most important, what guidance was most trusted, and what we should push out to the team. rather than leaving this to our property managers, we felt it was important to have this team address it so that they could spend the time really vetting the information and ensuring that we were providing the best guidance to the field. So I think that really helped support our property managers and what their efforts were. Having this team together also led to the development of a command center. We developed this command center at the hotel at the University of Maryland, which unfortunately we had to shutter on March 18th, but we kept the hotel operation going as it relates to this command center. And the command center was led by our safety manager, Mel Jenkins. Mel Jenkins formed a team of, some of them were his existing safety team members, but others came from other areas of the hotel division or the residential division, commercial division. And Mel trained them all in safety and in sanitizing effectively, how to sanitize areas that may have been exposed to the virus. So what would happen is we would get a report of a potential exposure, for example, and Mel's team would automatically be dispatched 7 days a week, 24 hours a day. His team would be dispatched immediately to the area that was potentially affected. And again, our goal was the safety of our residents and team members. So it was important to just scour the areas and try to address every single possible area that could have been breached. So we feel as though that was a very, the sense of urgency that Mel and his team displayed and exhibit on a daily basis was really critical in trying to keep down the spread within our own communities. And that obviously was just something that we could bring to the table that would help the overall issue that we were all confronted with. So the command center was critical in our COVID response efforts and continues to be critical today. I'd also, the team developed several action plans, one for each discipline. We have the residential division, we've got the hospitality division, the commercial division, the corporate division, several different areas. While the intentions were all very similar, they had to be tweaked and tailored accordingly based on the division. So the COVID response team was key in getting those teams focused on what the various levels of actions that should be taken when various things had been reported through the process. We instituted policies which now seem like common sense, but early on we instituted the policies of closing fitness centers, all to facilitate social distancing, community centers. How do we communicate with our residents online and by telephone a little more effectively so that we didn't have to breach that physical distance? You know, we developed home plans for working at home for whomever could possibly work from home was encouraged to do so. Enhance the frequency of normal cleaning practices. And early on in the team's formation, I think it was mid to late March, Suzanne actually brought up the point that, you know, at some point we're going to run out of masks. We can't possibly have enough masks, and we might have difficulty finding them. Let's develop a team at the command center that we can start making our own masks. So late March, we began development of our own masks and face coverings for our employees, and it's been an excellent production there. We've made hundreds and hundreds of masks. And then, you know, throughout this process, developing and implementing a more robust communication strategy designed to ensure that both residents and employees would receive the appropriate information regarding the pandemic and any of our efforts as it relates to our response to it, including information regarding availability of government programs designed to provide relief to some of our residents. Anything that we thought could be helpful to our residents or our employees, we would vet through this team, and then we would push out to the field. And I think, you know, when all this is said and done, and hopefully it's sooner rather than later, we're going to look back and we're going to try to figure out, what were those best practices and how can we apply them to the future? And clearly, above anything else, transparency and communication was critical. From day one, forming this team and having the right leaders on the team and effectively communicating through this team to the field and to our residents has been very important. And being 100% transparent with our residents and team members, what was going on. We're not afraid to let people know that there's a possible contamination in a particular area of a particular building. And we will communicate that directly to the residents, first by phone call and then by email to every single resident to let them know what's going on. While we do have to protect the privacy of individuals, and it's not really necessary to reveal somebody's name, but it is necessary to reveal the areas that they've been exposed to and what we've done about it. So we feel very strongly that has really helped us in the fight against this thing. And I also have to say our property managers have really been instrumental throughout this process. The relationships that they have developed with residents is critical. They are serving more in a support role and a response role than anything else. They're not afraid to field calls from our residents and answer questions or provide whatever support we can possibly provide. And I think in some situations that's not always the case, unfortunately. But being there, having strong relationships with our residents is so important today, and it's going to help us into the future. And I think when I look back, and I've only been with Southern, unfortunately, for the last 2 years, but Southern's been around for the better part of 55 years. And it's always been the cornerstone of Southern's foundation to be a good citizen. Above anything else, be a good citizen. Do the right things in the right ways for the right reasons, and it'll lead you to the right response. And I think that's the guiding principle throughout this process that we've followed and try to stay true to. So thank you again for letting me share what Southern has done. And I'm happy to know that, it was a resident that actually recommended that we be on this. So that was comforting. And I wish you and all of your families good health.
Thank you, James. That was wonderful. And I really appreciate hearing about all the steps you've taken to keep your residents safe and healthy. And I'm sure that they are too. And next up, we will be hearing from Dr. Galiatsatos.
Excellent. In the world of Zoom, you always have to make sure that you are unmuted. Can't do that in real life where someone just starts talking and nothing happens. So first of all, it's such an honor to be part of this panel. The approach that I and a variety of other colleagues are taking is, yes, we have to try to emphasize the stop of the spread of the virus. And one of the ways we can do that is exactly by joining the community, talking about why these guidelines are made and how to best abide by them. And Mr. James, I love your input, because leadership such as yours that hears these guidelines and then tries to best accommodate them with living situations that you oversee is important. It's valuable. You know your housing units better than any public health official or physician, so you can help best adapt those principles that are being requested. So I applaud you for being part of this conversation, and I hope other housing units take the same approach to hear about what we're recommending and how to best apply it. But from my standpoint as a physician, so I'm a lung doctor and critical care doctor, I put that first because oftentimes people discuss us being the front line, and I want to make one very important point clear: we're your last line of defense. If you get the virus and you become symptomatic enough that warrants hospitalization, your doctors and your nurses are your last line of defense. So who is the front line is you all, the community, and being able to understand the guidelines, why they're recommended, is going to be incredibly valuable to preventing the spread of the infection. And more so if you do get it, to potentially try to mitigate the symptoms that it will have on you. So let's talk a little bit about COVID-19 in a way that this information can be actionable for you all. So first things first, any infection that exists, what we try to understand is how it is spread. And this is whether it's from aerosol or just a pure airborne disease. At the end of the day, it requires a cough, a sneeze, or simply breathing for it to leave one host to enter the space of another host who could potentially breathe it in, or touch a surface where from their hands can get into their eyes, nose, or mouth. Why your hands will be there is up to you. So knowing that, the first comment then is this conversation about social distancing, quarantining, and so forth, trying to keep people as far apart as possible. And the 6-foot radius, as I always emphasize, is because if I'm actively talking right now, the virus's highest concentration is within that 6-foot radius. And that's important to note because it's not that you need one protein, one dust of the virus. You need a good amount of it in order to invade you all at once in order to cause an infection. So being able to be as far apart as possible is very important and crucial. So Mr. James, when you were discussing potentially common sense things like shutting down fitness rooms, that's powerful, right? That's one of the ways you can create social distancing, because you take areas of the community that people come together and now you halt that. And how does social distancing, the most extreme example I always love to share is think about the first time you've heard of COVID-19, presumably sometime in 2019 around December, and you heard it's in Wuhan, China. And I imagine you all had the same response as I did. That's 3,000 miles away. That is not going to affect me. But in reality, if you think about it, that is the most extreme form of social distancing. Now that it is in Baltimore City, this conversation about keeping everyone quarantined and appropriately far away is important because it keeps the virus from being able to go from one individual to another. But at the end of the day, we're all human. And this virus doesn't have a timeline. When people discuss the pandemic of when will it end, that's really not the right question. Endings to natural disasters occur in things that have a spatial and time constraint, right? Like a wildfire or a hurricane. A virus kind of dictates its own timeline, and there's so many variables that we're learning about in real time. So the reason why I stress this is because as we keep extending lockdowns and quarantining, at some point in time, you're going to have to emerge, shower and brush your hair and put on some clothing and go outside. And so that's where we emphasize point number 2 about the face masks. So from the face mask conversation, I want to dichotomize them. Group 1 will be called respirators. I feel like I need to make this distinction so people can understand why there's really 2 types of face masks. Respirators are face masks intended to be worn by people who will actively engage with infected individuals, right? So these are like your N95 that you hear. So a little trivia, the reason why it's called 95 is because it shuts off 95% of the air particles, right? There's still allowance of about 5%, just so you can breathe, right? If it was 100% infected, people would just suffocate. So N95s, or respirator masks overall, those are masks meant to be intended for use for individuals who will go and engage with others who are actively infected. So those masks need to be reserved for healthcare professionals, right? Because those masks protect me from getting infected. They're a limited resource. But the other part that I really need to emphasize, because people still want to say, oh, I'll just go ahead and buy some. It's not as easy as it sounds. You can purchase, but what I think gets lost in the conversation is these masks need to be proven to fit you. So every 3 years, for instance, I and all my colleagues, nurses, doctors, we get retested, right? We get refitted to see if this size of an N95 fits, or do I need a smaller one or a larger one? Fit testing is very important, right? Because if you get an N95 or a respirator mask and it doesn't fit you appropriately, it doesn't do anything, right? It's going to allow the infection to come in. So that's one of the reasons I like to emphasize that respirator masks, please, those are meant for people actively engaging with infected, just so we can protect ourselves from getting sick. The other category then, they're called surgical masks, but it's kind of the general term. But that's exactly what Mr. James was discussing about what we're making, right? These masks that the government has asked to be worn as you go out into the public. The reason to wear them is not to protect you from getting sick, getting infected. It's just so you don't spread it to others, right? So it's kind of analogous to like an elbow. If you cough or sneeze, you coughing right into that. The face mask is meant to protect as you talk or cough or sneeze, particles, large droplets to leave and enter the air where someone could breathe it in. What type of face masks are the appropriate ones? I love that question, because suddenly we all become these kind of engineers of designer clothing and so forth. Long story short, not to overthink overthink this. There's two qualities to a proper face mask. The fabric material really isn't going to be that important, whether it's cotton, polyester, silk. Actually, there was one study back in 2015 that showed vacuum filters were amazing, almost on par with a surgical mask. But the important part is you need the fabric to be incredibly tight, just like a shirt material, right? You can't see through my shirt, right? You need it to be that tight. So that's important point number one. Another part is it needs to be well fitted against your face. Not like a respirator mask, but it needs to be able to cover up your face completely. So if you wear a mask where you can easily see someone's nose and mouth, that mask isn't doing anything. You need it to be well fitted against your face so it actually is keeping any skin exposure. So those type of masks, you can use your imagination. You can purchase the surgical ones like we have, or you can make some own, like Mr. James was discussing. Or there's some fantastic YouTube videos where you can take a typical t-shirt and convert it into a mask. That does the job. The only thing I will say is once the mask you wear gets wet, from moisture, it loses its efficacy. So you should replace it or wear a new t-shirt if you opt for the t-shirt approach. Because once it's wet, droplets can move in and out pretty easily. So we discussed social distancing, we discussed the face masks. And the third part that I want to emphasize is the washing of the hands. I mean, the ability for people to be cognizant of how often you touch your face will drive anyone crazy. I right now touch my face probably several times. So you guys are like, oh, I'm calling out that doctor. Please don't. I'm well aware of it. So what I want to say though is, since we're probably going to be touching our face, we're human beings, that's what we do. Washing your hands. So what I try to tell my community that we engage with on these in a variety of platforms is trying to go into a habit of washing or at least hand sanitizing once every hour to 3 hours is the appropriate measure to take. A variety of reasons. It's just because you don't know what you bring back home if you happen to have gone shopping and so forth. Because again, we can extend the quarantine as long as we want. At some point, we will have to go out, get groceries, get pharmacy supplies and so forth. So as you come home, you want to be cognizant that I may have brought something back. So washing your hands. So every 1 to 3 hours, or even just using hand sanitizer, and just almost every hand sanitizer sold in the market has an alcohol content of 60% or higher. That's perfect. That's all you need. So that's what I usually recommend. If you want to make your own hand sanitizer at home, great. Just make sure the alcohol content is appropriate. This also means the typical alcohol we drink is not going to be sufficient enough. If you consume that much, that is I wouldn't endorse that. Let me put it that way. So social distancing, face masks, and the washing of the hands. Those are 3 key things that you can to help stop the spread of the virus. Why that's important is because if people aren't getting infected, they're not coming into the intensive care unit where I have to help manage them. And why that's important, just to emphasize this part, is it's what drives the hospitals at the moment with a strong sense of urgency is the resources overall. Managing a typical patient with an airborne disease, right, an airborne infection. So we're not talking about COVID-19 specifically, but just anything that's airborne. Tuberculosis, for instance, was an airborne disease. When you manage a disease like that, you need a very specialized room in a hospital to have that. Not every room of a hospital is designed like that. It's called a negative pressure room. And a typical community hospital, for instance, for every 100 beds, they only have 4 negative pressure rooms. So if 8 people show up one day to a community hospital, that community hospital is going to take 4 and try to send the other 4 to another hospital, right? So what I'm alluding to is the reason why we plead with everyone is hospitals aren't designed to take on a lot of patients all at once with this airborne disease. A, and B, once someone that is infected ends up in a hospital, it's not just a specialized room, but you usually need about 6 to 8 people just to best manage them, from nurses to physicians, in a single day, in addition to a variety of other machines and so forth. And then finally, the last part I want to say is COVID-19, if you do end up getting it, unfortunately, and you get so sick from it that you end up in a hospital, the average length of stay for someone, regardless if they're in an ICU or just a non-ICU bed, is about 21 days. That's how long the symptoms of this continue to ravage someone until they begin to heal. So if you think about that, just one person, 21 days in a hospital, a hopefully no one just heard that and said, oh, that sounds fantastic. No, I promise you, being a patient is not an enjoyable experience as we try to soothe you back to healing. So why I emphasize that is so you can stay, as Mr. James was saying, transparent. So we can stay transparent with you all to understand why we plead with everyone to follow the social distancing, to follow the face masks, and to follow the hand washing requests. They may sound easy, right? But I promise you, it is the best way to curb the spread of this virus and keeping the ability for hospitals and healthcare systems to not be overwhelmed all at once. All of this, by the way, can change if we get a vaccine. However, the pace of science for a vaccine is not one that happens overnight. You cannot Amazon or Prime a vaccine to come within 2 business days. It takes time, right? We need to not only identify the protein of the coronavirus of COVID-19 that we can target with a vaccine, then we got to test it. We got to make sure it works and it's safe, and that takes time. Or coming up with a antiviral, right, kind of the equivalent of an antibiotic for a bacteria, also takes time. The pace of science, I promise you, is not one of a fast pace. And in a pandemic where we need a cure right now, it must feel like forever. So bear with us. The best way to beat COVID-19 is to not get it. Listening to Mr. James discuss how Southern management is adapting to all the guidelines put forward is fantastic. I applaud you all for taking those initiatives. And then from my standpoint, other than listening to what your housing units are requesting, these simple recommendations, I know they sound simple, but social distancing keeps the virus from actually going from one person to another. Face masks so you're not actively coughing it out or breathing it out or sneezing it out. And then washing your hands, because God forbid you touch a surface with it. Guess what? Washing your hands will kill it off. So those are the things that I like to bring up about COVID-19. And obviously, Emily and others, I'm happy to take some questions.
Wonderful. Thank you so much for sharing your expertise. And I really appreciated hearing the distinction between different types of face masks. So before we begin the Q&A section, I would like to provide 2 important reminders. So please take the time to vote in the upcoming Maryland primary on June 2nd. It will mostly take place by mail-in ballot, and those ballots will be mailed in the first week of May. So please keep an eye out for those. And if you haven't already, please take 5 minutes, it's extremely fast, to fill out the 2020 census. And you can do that online at 2020census.gov. And again, I just want to take the time to thank our panelists for joining us today and sharing their expertise on these topics. I know we've had questions coming in throughout the conversation, and we are extremely excited to be able to go through some of those. And for all of our attendees, just know that we are monitoring those questions, so please continue to send them in. And I will open it up for a discussion now.
Great, thanks, Emily. So we're going to start with a question we have here for Dr. G, which is, should people be wearing masks in hallways, elevators, stairwells inside their apartment buildings? Yeah,
so the immediate answer that I have is yes. I mean, those are all public places that you're engaging with others. And, you know, just think about it conceptually. You don't know if the last person in the elevator just had a big coughing spell, right? So they just flooded that elevator without a mask, and all the COVID-19 particles are in it at the moment. Not to frighten anyone, but one of the ways it spreads within hospitals and how staff get it, even if they never manage a COVID-19 patient, is just that, right? People take off their masks in an elevator thinking they're fine, they're touching buttons, then they touch themselves and they get it. That's been proven in Wuhan, China, and a variety of other kind of really unique hospital research projects during this pandemic. So yes, if you leave your apartment building, I would strongly encourage masks to be worn at all times until you return. And once you return, wash your hands. I would actually say wash your hands first, mask, go out, come back, mask off, wash your hands. That's what I would strongly encourage.
So a follow-up to that, Dr. G, is there anything considered being oversafe? Like, are you supposed to move your to-go food into a different container? When you go grocery shopping, are you supposed to spray things down? What is the safest and smartest way to handle those types of things?
Yeah, so I mean, and that's a fantastic question. I would say, so the virus, once it lands on particles like plastic or cardboard, within 4 to 8 hours, more than 50% of the particle is gone. And I want to emphasize that because when you see these studies that say, oh, the virus can live there for 3 to 4 days. Yeah, that means like the smallest fragment of the virus is found 3 to 4 days later, right? That's not enough to cause an infection. Once 50% of the virus is gone out of a concentrated area, it's unlikely to really cause any kind of infection to an individual. So what I usually say is if you get mail, right, if you want to leave it outside of your door for 4 hours, fine, it'll go away. If you bring it in, you can Clorox it right down. If you go out to the grocery store and grab stuff and come back, you can do the same thing, just leaving it out. After about 4 to 8 hours, the majority of the virus is gone, and so it in and of itself is no longer contagious. Wash your hands. That also makes sense. If I grabbed a box from the grocery store, I came back home, and leave these out for a little bit until, Dr. G said the virus is gone, I'm gonna wash my hands at the same time. Once you've done that, you're good. You're good, right? You're no longer infected by it. So that's how I would recommend it. And listen, at a time like this, I would always encourage being overly conservative and being laughed at than being under conservative and being yelled at once you have the virus and so forth. So for those people who are like my friends who are germaphobes, they're not loving life, but they are like welcoming the fact that everyone else now is on their level at the moment. So that would be fine.
Great, thank you. Our next question is for James. James, in any of your Southern management buildings, do you have pet areas, and are they still open? If so, how are you safely managing those spaces, given that some pets have gotten the disease, and is that a concern for you?
No, unfortunately, all of the public spaces like that are closed off. So they are restricted to try to do our best to prevent people from gathering.
Great, thank you. And then a follow-up for that, if some of the residents here are, for you, James, living in a housing unit that is not as responsible or managing it as well as Southern management, how can residents bring up to their management, property managers, better practices, et cetera, for them?
Yeah, I feel for the property managers that are in some of those situations because, they are the front line and they're between a rock and a hard place because they're not getting the proper support, and that's unfortunate. But I would encourage a resident that's in one of those types of communities to go to the top. Not that the property manager isn't effective, but they can only do what they can do. Their hands may be tied. Go to the senior level management within that property management organization and voice your concerns.
Great, thank you. Another question for Dr. G. Let's go. So it's, how would you describe testing availability at this time and the turnaround time for results? Also,
Right.
Where can people get tested, and what are the requirements that must be met in order to get tested?
Yeah, so to get tested, first you need to be screened. So, and this is not to transition into any kind of politics, but we have enough tests to test those who are symptomatic, but not enough tests to do, say, on the level of what South Korea did or Norway have done, where they did mass testing in order to identify also the asymptomatic patients and really understand what the denominator is, to give these mathematical models that are going to dictate public policy a lot more reassurance that you're following the right path. So to get tested here in Baltimore, you first need to be screened. So screening means you call a healthcare professional. If you don't have one, you're welcome to contact even my group. We would rather you flood the phone lines than the hospital lines. So you call, and what we go over is your current symptoms. So if you have fevers, chills, coughing, shortness of breath, we go over kind of these symptoms, kind of, which ones do you have that are in accordance with what COVID-19 would be causing. If maybe say you don't fulfill the symptoms, but you came into contact with someone with COVID-19, you're in an elevator with someone who sneezed on you and you found out they were COVID-19 positive, right? That's another risk factor that we take into, accountability, saying, okay, yeah, you might have to get tested. And then finally, we also review then your pre-existing conditions, because there's certain conditions that will mask COVID-19 symptoms, but may create some insidious other kind of symptoms that we want to be cognizant of. This happens a lot in instance for patients with weakened immune systems who won't develop fevers, they won't develop a cough, will develop subtle other things. So at the end of the day, what I would talk talk to your healthcare professional so they can screen you, and they'll screen it by symptoms, pre-existing conditions, and risk factors such as I've interacted with someone who was known COVID-19 positive. If screening work goes to the next level, meaning to get tested, then they'll work with you from a geographic area. There's testing sites at Hopkins and at Maryland, and a variety of other local hospitals, as well as some other pop-up testing sites that are happening throughout the community. All of the healthcare professionals are fully aware, so they will 100% tell you where that is. So what I would encourage strongly is talk to them and say, great, where can I go get tested now? The one thing though I do want to emphasize is wherever you go get tested, talk to the site and find out what their turnaround time is. That's very important. At a Hopkins, for instance, turnaround time can be anywhere from 4 to 24 hours. Other sites might be a send out, and that's really important because I've had a patient go to a hospital and say, Dr. G, you told me 4 to 24 hours. You told me about a week. Yeah, so if you go to that site, ask them, hey, how do you handle this? Do you send it off to another lab to run it? Because that's the case, the turnaround time might be too long. So talk to your healthcare professionals. If they identify lab, unfortunately, it involves you talking to the lab and finding when it is. And if that time is too long, call your doctor back and be like, hey, I need another site to go to. But right now, we have enough testing kits to test patients who are likely to be symptomatic. And so those are the patients that get screened and so forth. Why that's important to know is because if you get symptoms, what's really diabolical about this virus is you have usually about, the way it works, right? The incubation period is about, on average, 5 to 7 days, meaning you'll get the virus, you get infected, you're asymptomatic for about 5 to 7 days, then you develop symptoms. And the symptoms you develop are not the same symptoms that you'll end with. For some patients, it will get worse. 1 out of 6 patients develops severe symptoms over a week's time that land you in the hospital. So that's why we try to screen you, because if you are positive and you come into the hospital, the healthcare team knows how to best allocate the resources they need to take care of you. So that's where we're at with testing. Finally, the last part I will say is there is a 30% inaccuracy with the nasopharyngeal swabs, the test where you go in the back and you swab that area. The reason being is we're at the mercy of the anatomical location of the virus to be present there. Or sometimes if the virus transitioned only to a lung infection, it's going to be negative here and only abundant in your lungs. So if I have a high suspicion if a patient likely has COVID-19, I will let them know that. So I will tell the patient, hey, even if it's negative, I want you to act as if you have COVID-19 and socially isolated, socially distanced. So keep all of that in mind as you talk to your doctor and discuss, hey, if this comes back negative, what should I do after that?
Great, thank you. We have a question for both of you, and if James could go first. The question is, where do we stand on safety in public spaces for dog walking and exercise and going outside? What are property managers doing to help prevent group gatherings around their buildings? And how safe are we by going outside?
Well, I think from the property management perspective, we're not policing specifically these areas. We're providing the best guidance we can. We don't want to put our employees in harm's way either. So there's really a fine line. The best that we can do is provide thoughts and ideas as to alternate areas to go. If you're walking your dog or something to that effect. But, if there are gatherings, then we will, do what we can to disperse those gatherings or discourage them. Fortunately, we haven't had that situation too often, and people have been very responsive when we have had the situation.
And Dr. G, your thoughts on that as well?
So I agree with Mr. James. I mean, from my standpoint, I would encourage everyone, if you take those proper precautions that we said, how safe is it to go out? It is safe if you socially distance, wear face masks, and wash your hands before and after you return home. If you take those precautions, you are not removing, but you're definitely minimizing the chances of you getting infected.
Great, thank you. We have a question for you, Dr. G, which is, as a healthcare professional working in the front lines, what are you doing to remain positive throughout this pandemic? And what are some wellness tips for those in apartment buildings as well for them?
Right. So I think one of the resources that we need to emphasize overall is, what do we do about the healthcare professionals, right? They're the ones who are going to be really maxed and taxed during this time. And, it's highly appreciated that everyone discusses, thanks for all the work that you all do. That's great. That's fantastic. We talk about, are we going to have a shortage of machines? Are we going to have a shortage of medications? The biggest thing is really a shortage of human capital. So what I would strongly encourage is what we do is work with you all, like engage with us, talk to us. You're welcome to ask how our day is, but I think the more important thing is, to follow by these quarantine rules, socially distance. It means a world to us because it means you recognize how severe this virus is and how much of an impact it is having when patients come into the hospital. So what my colleagues and I are doing to keep ourselves somewhat sane, we're really honestly interacting with you all. Like this helps, like being able to talk to you all, to really emphasize you guys are out there on the front line, that all helps. So I really appreciate that question, but at the end of the day, it's really you guys helping us remind us of our humanity and going with this together.
And do you have some wellness tips for those living in apartments as well?
From a wellness perspective, I mean, the biggest challenge is, the things that we define ourselves as humans. It's always been kind of a presence, right? Being at a bar or a restaurant or a movie theater. I mean, being in a camaraderie with other human beings. And that variable is lost during an airborne pandemic from a contagious substance. And so the wellness activities that I would strongly encourage, as simple as they can sound, talk as much as you can to other people, like by phone or Zoom. From a media standpoint, try to minimize how often you listen. And I see this because, all day, we're going to report on how bad things are. Listening to that for 24 hours a day is going to make anyone anxious. So wherever you get your media outlet, that's great, but I would try to, minimize it. Listen for an hour, get the updates, see where we're at, great, move on. Listening to it all day is going to create a sense of anxiety and stress that is going to just be too much for this time being. So engage with others as much as you can without the physical presence, phone calls and so forth. And at the same time, the other part is not to feel like during this pandemic, more should be expected of you. And I know this comment, it sounds more for academia and others in a profession where people are like, oh, now you have so much time to catch up on your writing your manuscripts or reviewing this or that. Don't feel like you have to put that type of pressure on yourself. I would start off, simply have a simple goal for today and see if you can try to accomplish that. But don't feel like this pandemic is a kind of a get out of jail of catching up with all of your other things that you've put off to the side. That's just going to create an unnecessary burden. So I would always encourage to realize we're in a pandemic. We've never been in one before. You're welcome to kind of follow the pace that you want, that makes you comfortable, because we're all kind of in real time learning for the first time ever how we go through a pandemic together. So that's what I would emphasize. Don't overextend yourself. Talk to others as much as you can, and really minimize how often you listen to the news at the moment.
All right, thank you so much. Unless anyone has any other questions or final thoughts from our panelists, we will actually be sending out a quick poll to all of our attendees. So that should be popping up on your screen as I speak right now. And finally, we'll go ahead and give you a few minutes, or sorry, a few seconds for that, and we'll actually go ahead and just switch to our next slide and wrap things up. All right, so in closing, I just wanted to make sure that everyone is aware that we do have a full library of COVID-19 resources, along with virtual event listings and relief initiatives that can all be found on our website, godowntownbaltimore.com. And in the next few days, just be on the lookout for a recorded version of this webinar, which will be emailed to you as well as be posted on our website. And once again, thank you all so much for attending today. Please feel free to reach out to us, email if you have any further questions. And again, thank you to our panelists so much for joining us and sharing your expertise.